Hello and welcome to the Pediatric Brain Tumor Foundation's webinar, Nourishing Health Nutrition Strategies for Families and Children with Brain Tumors. My name is Alex Henderson, and I'm the Bilingual Family Support Manager for the Pediatric Brain Tumor Foundation. Thank you for joining us today for this important subject. Before we get started, I have a few guidelines to review. You're muted for this webinar and your video is disabled, but we welcome questions during and after the opening remarks. You can type your questions into the Q&A feature found at the bottom of the Zoom window. We won't get to every question, but we'll try to answer as many as possible. We're pleased to welcome Kathryn Sullivan and Jessica Cavall for today's webinar. Kathryn Sullivan is the Senior Research Nutritionist for the Integrative Therapies Program. In this position, they work with individuals participating in the division's nutrition-related research studies, as well as pediatric oncology and stem cell transplant patients in the outpatient clinic. This work includes providing nutrition counseling, education, and therapy to patients, their families, and caretakers. Prior to their current role, Kathryn assisted in the treatment and care for patients recovering from eating disorders as an inpatient dietitian at Robert Wood Johnson University Hospital, Somerset Inpatient Eating Disorders Unit. And they received their bachelor's degree in nutrition and food science from Montclair State University and completed their dietetic internship at Stony Brook University. And Jessica Cavall is a registered dietitian and certified specialist in oncology nutrition. She's been practicing in pediatric oncology and blood and marrow transplant for over 7 years. Her work experience has been with the Children's Hospital of Richmond and Children's National Hospital. She currently works for the Integrative Therapies and the International Initiative for Pediatrics and Nutrition Programs under the Pediatric Oncology team at Columbia University Irving Medical Center. She received her undergraduate degree from Rutgers University and master's degree in clinical nutrition from New York University. She enjoys volunteering for her local pediatric cancer nonprofit organizations in both Virginia and New Jersey. So it gives me great pleasure to introduce Kathryn Sullivan and Jessica Cavall.
Thanks so much, Alex, for the introduction. Let me just minimize this. All right, so we'll go ahead and get started talking today about pediatric brain tumors and nutrition. So why is nutrition important, or kind of our overview and objectives for today? First and foremost, for all of us, nutrition provides our energy and our strength. And then it also provides the building blocks for all of our cells to work at their best. And most specifically, what we're worried about with cancer is our immunity cells. It also helps us manage the unfortunately wide array of side effects that we experience during treatment. And staying healthy throughout treatment will help promote long-term health into survivorship. And throughout the presentation, we'll be throwing in a bunch of myth busters for you as well about common things you may have heard about cancer and nutrition. And so we'll start off with the basics of nutrition needs.
So just as a general overview, when we look at food and what it provides to our bodies, it typically falls into one of 3 categories. It's going to be a carbohydrate, a fat, or a protein. Most people are familiar with carbs. Those are our grains, breads, fruits, and veggies, and they are our primary source of energy. They help maintain our blood sugar. When we look at fats, those are things like nuts, seeds, oils, fatty fish, avocados, full fat dairy, things like that. And fats help us with energy storage. They help protect our organs, and they help make up our cell membrane structure so that cells are not rigid and have that fluidity and ability to move around. Like when you touch your skin, it's not really rigid. Proteins are meats, fish, eggs, beans, nuts, legumes, help us with things like muscle building and maintaining cell structures.
And so we're going to jump right in with our first mythbuster of the day, soy and cancer. So we were just discussing protein, and the main benefit of soy is that it is a solid protein source. A lot of our patients, when they're undergoing treatment, this is more anecdotal, not science-driven, but they tend to lose the taste for heavier protein foods such as meats. And so soy can offer a really good protein source. It also has components called isoflavones and other micronutrients such as fiber, selenium, and calcium. And research suggests that soy does not increase cancer risk, but may lower it. So this theory about soy causing cancer, if you've heard about that before, it really stems from our phytoestrogens that are in soy, and they bind to estrogen receptors in the body. So this has been shown recently to show slow cancer growth. However, in older rat studies from decades ago, a certain type of phytoestrogen was seen to increase the estrogen receptor positive breast cancer cells specifically, and actually promoted growth of the breast cancer. However, it was since learned that rodents metabolize these phytoestrogens differently than humans do. And when we're looking at scientific research, we often start in mice studies before moving on to human trials. And when we moved on to human trials, we saw that consumption of soy foods actually lowered the risk specifically of prostate, stomach, colon, and breast cancer. And more particularly looking at studies of women in Asian countries where they tend to have a high intake of soy, we saw lower rates of cancers. So the only thing you really want to be cautious about when consuming soy is that a lot of soy products that are kind of like your fake versions of meats tend to have a lot of additives and stabilizers that could not be good for your health. But if you're consuming 100% soy, like either soy, tofu, tempeh, or soy milk, those products can offer really good nutrition when you're going through a hard time with appetite.
On top of providing us with those carbs, fats, and proteins we were talking about earlier, foods like soy, meats, fruits and veggies are also going to provide us with things like vitamins and minerals. And when we're taking a look at these items that food provides us, those carbs, fats, and proteins are considered our macro or big nutrients. Our vitamins and minerals are our micro or small nutrients. So these aren't necessarily providing us calories, but vitamins will help us physically break down food. They help us use the energy that we actually get from food, build tissue, help support our immune system, and even help our blood have its clotting ability. So if you ever get a cut and your body forms a scab, that's thanks to some of the vitamins that you're eating to help make that happen. Minerals help us form bones and produce hormones that help our body run.
Our next Mythbuster is specifically about milk and dairy products. Dairy products offer a lot of those vitamins that Kath was just discussing, as well as are a good source of your macronutrients like your proteins and your fats. Milk and dairy products can be a really good source of getting you protein again when heavier protein foods such as meat and fish might not be sitting well. The reasons to avoid dairy, aside from religious or cultural reasons, would be either lactose intolerance or milk allergy. And people tend to misconstrue these two terms. So if you have a lactose intolerance, you're sensitive to the carbohydrate component of milk, which is lactose. That tends to be seen through typical GI symptoms, diarrhea, cramping, things like that. Versus a true milk allergy is a systemic immune response to the proteins in milks, which are casein or whey. This is generally seen pretty immediately around birth or under 1 year of age, and it's seen with blood in the stools. So aside from those two reasons, if you do not have an actual intolerance or allergy, we support dairy products during cancer treatment as a really good alternative to provide nutrition. So when you look at this chart comparing cow's milk, soy's milk, and then other nut and grain-based milk products, you can see that the cow's milk and the soy milk really contain a much more nutrient-dense option in terms of calories and protein. We worry a lot about making sure we're getting enough protein in our diet throughout treatment to prevent muscle wasting. And sometimes it can be a little bit difficult to meet those protein needs, but if you see the protein in 1 cup or 8 ounces of milk, it really can be a good booster for the diet. So we really try not to avoid it unless we have true symptoms of intolerance or allergy.
3 of these vitamins and minerals that we tend to see impacted most often through treatment are potassium, magnesium, and vitamin D. Potassium helps cells maintain their electrical charges, and in doing so actually helps in muscle contraction or pulling your muscle in. It also helps nerves transmit their signals. So if you or your child or somebody you know is noticing their potassium is dropping through routine blood work, Some foods that you can include in your diet to get potassium-rich foods are going to be things like papaya, prunes, bananas, grapes, butternut squash, and tomatoes. Magnesium actually aids in bone formation, muscle relaxation. So potassium helped us flex. The magnesium is going to help you relax or unflex, as well as energy use within your body. And some foods that are going to be rich in magnesium that you can include are things like pumpkin seeds, dark leafy greens like spinach, Swiss chard, cashews, foods like that. And lastly is vitamin D. Vitamin D is one of our fat soluble vitamins, meaning that you actually need to eat fat to actually absorb this vitamin. Vitamin D aids in bone formation. It helps you absorb calcium and supports your immune system, helps you regulate blood levels of calcium and phosphorus. And some food sources of vitamin D are shiitake mushrooms, cod liver oil, salmon, mackerel, the fatty fishes, egg yolks, and things like fortified milks.
Okay. One question we get asked a ton about is how do I raise my white blood cell count? How do I raise my neutrophil count, which is that very specific type of white blood cell that we need to increase before you can continue your next cycle of chemotherapy? And unfortunately, our mythbuster is that there is no immunity superfood. Things advertised as superfoods is exactly that. It's an advertisement. There's no one food that contains all the nutrients your cells need to be constantly rebuilding, and that it holds true for your immunity cells. The honest truth is that there's a wide variety of those vitamins that Kath has been speaking about that are involved in building your cells and keeping their strength. And so my favorite piece of advice for keeping our immune system up is to try to eat the rainbow or eat one color from every row of the rainbow every single day. That can be a little hard when you're going through treatment, but just trying to keep color and diet variety is going to be your best bet. And of course, that means not coming from food dyes. I know that's a sensitive topic right now, but naturally colorful foods. If you get a variety of colors, that means you're getting a variety of vitamins and minerals, and that is what's going to help build those immune cells when, like your white blood cells and your neutrophils, after we've destroyed them from chemotherapy. Another key component to cell building is protein. So making sure, again, you're getting enough protein in your diet is very, very important throughout treatment. So focusing on those foods in your diet can also be really helpful to keeping your blood cell count up. And also eating foods that contain iron will help increase your hemoglobin levels, which is another type of blood cell. So again, just maintaining your blood cell health. And a little bit of research has kind of shown that maybe dark chocolate might help raise your ANC. They're not entirely positive why it's that one specific food, but if you want to treat, choose some dark chocolate. Then in terms of multivitamins specifically, you have to be really careful with multivitamins when you're going through treatment, and you always want to confirm with your doctors at your hospital if they're okay with you taking those throughout treatment. The main reason being that, like we've been talking about, vitamins are really a big component of cell building and regeneration. And so they can interact with how we metabolize and absorb our chemotherapies. And then they can also interact with how we clear and delay how we clear certain chemotherapies that we really want to get out of our bodies as soon as possible. Specifically, a most common example is methotrexate. So it doesn't mean you can't take vitamins, but what you want to look at is what we call your recommended dietary allowance, or the RDAs. This is the established amounts of how much of a specific vitamin you need to consume daily based on your age and your sex. So when you're looking at, this is a label from a vitamin, or a pediatric multivitamin. So what I look for is, I don't really care so much about the brand you're choosing. I'm looking at two things. One is these two columns here, which say percent daily value, which means what percent of the RDA is this vitamin giving. And then it's usually broken down by age. So then you look at this column with all these percentages. So for example, what this vitamin is this label is saying is that this specific vitamin will give a 2-year-old 67% of all the vitamin D they need for that day. What you want to avoid is vitamins that do what we call hyper supplementing, or giving well over 100% of how much your body really needs. So I like this column for all these numbers to be as close to 100 as we can get, whether that's a little bit under or a little bit over, but we really want to avoid these big numbers. Like this vitamin, for example, gives 300% of vitamin C for the day. So when we get back to this example of delaying clearance, vitamin C has been shown to delay clearance of methotrexate. Now that is seen when we're taking it in very large quantities. So if your child still wants to have a cup of strawberries that day, the amount of vitamin C in that is not going to affect your methotrexate leaving your body, but consuming 300% of what your child needs in vitamin C for the day with one vitamin might delay the clearance of your methotrexate. So this is what we look at, is this column. And then we also want to look at this list on the bottom of ingredients. My unofficial rules of thumb are the longer the list, generally the less desirable it is, because that means more additives, and the more words that you don't understand what they're saying usually means more additives as well. So when I'm telling parents to pick a multivitamin, I want them to look for this to be close to 100 and this list to be as condensed and understandable as possible. You want to limit excess sugar additives. So specifically things ending in itol, so sorbitol, mannitol, erythritol, those are what we call sugar alcohols, and they're a way to add flavor. They're not needed, and in large amounts they can cause GI upset and diarrhea. So the amount that's in one vitamin probably isn't really going to do anything if we're being honest, but it could exacerbate an already existing issue. These other things listed, including stevia, are all still just versions of sugar. So we don't really need that. So that's just another thing to think about, is anything with sugar labeled on it, we'd rather see that further down in the list of ingredients. The further down means the less of that ingredient is involved in the makeup of the food or the vitamin. Then we move on to another common supplements I get asked about a lot, which are antioxidants and omega-3s. These are different types of nutrients, but they both have a very similar role in the body, that their big purpose is that they decrease inflammation. And that can be really helpful in cancer and cancer treatment and cancer prevention as well. So on one side, we have our antioxidants. This is a type of nutrient that helps prevent damage from what we call free radicals, which are basically unstable molecules in the body that can hurt healthy cells. Antioxidants are certain types of vitamins, including vitamin E, C, and A. And what you want to look for is any foods that are this bright red, orange, yellowy color. That means they're going to be high in these vitamins, things like carrots, sweet potatoes, peppers, cantaloupe, etc. Wheat germ, nuts, and seeds give you more of your vitamin E. If you feel like you don't consume enough of these foods, in terms of supplements, how much you should take is again going to be varied by age and sex, but you really want to be careful about not exceeding the recommended amounts, because high intakes of these vitamins can thin your blood, and our patients are already at a high risk of bleeding. So we want to be careful of that, as well as these vitamins are mostly processed and stored in your liver. So if you take excess of them, that could cause liver injury. And a lot of chemotherapies already have a high risk of causing liver injury. So we don't need to double that risk. When we look at omega-3s, on the other hand, those are a type of fatty acid that is needed for our cell health. Kath talked about the different types of fats, how they help with our cell building. But these types of fats, our body doesn't make them, and they have to be obtained from foods. So foods that have these are mostly fatty fish, but also some types of nuts and seeds. And if your child doesn't consume those foods, there are various brands of supplements with different concentrations. The needs for pediatrics ranges anywhere from 0.5 to 1.5 grams per day based on your age. and the max safe dose in adults is 4 grams per day. So you really need to be careful when you're reading bottles of how much it's giving and staying in that recommended range, because again, similar to antioxidants, high volumes of these things can increase your bleeding risk. In terms of other herbal supplements, this is a not extensive list of supplements that we consider higher risk, meaning they're safe to consume, but if you have them in high amounts, they could affect your chemotherapy or your radiation or other medications you're taking. So you just want to be cautious. We personally recommend some of these supplements for our patients helping with symptom management. So they're not a hard no, but you just need to be careful with the volumes and the brands you're getting of these supplements. So always checking with your medical team is important. The ones in red are usually a pretty universal no, because they interfere with a specific enzyme system in our body that's responsible for the breaking down of many drugs, not just chemotherapies. So most people will tell you to avoid those ones in red. I know garlic is written there. That does not mean like don't cook with garlic. Garlic can be very good for you. It's when you take supplements of high dose garlic oil that can then become a little bit harmful with this drug metabolism system that we have. So again, just always checking with your team, and they can cross-check if any of these have a high risk of interacting with your treatment.
Iron is one of the minerals that comes up a lot as a question of should you be supplementing it? Should you be avoiding it? It is found inside our red blood cells and helps our body actually move oxygen around from the lungs to other organs. Some of the foods that it can be found in are things like meat, liver, shellfish, kale, Brussels sprouts, foods like that. The research on iron during treatment, specifically for tumors, is really mixed. There is some evidence that iron deficiency can cause oxidative DNA damage. There's also evidence that excessive amounts of iron can cause DNA damage as well. Some studies show that some tumors are actually able to hijack blood cells and have them bring additional iron to them and help them grow. So the research is really mixed between if having a large amount of iron or a low amount of iron is best for treatment. So there's not currently a general consensus. It does seem like from the research that is out there that having a tightly controlled amount of iron is possibly beneficial. So there's not a good recommendation for or against having iron containing foods in the diet right now.
So we'll move on to symptom management now.
A bunch of these symptoms that we are going to cover are really common throughout cancer treatment. They can come together, they can come separately, before, during, or after treatment. So the first one we're going to look at is loss of appetite. And typically what we would recommend for that is having small, frequent meals of nutritionally dense foods, including add-ons. Things like cheese or oil would be considered an add-on. If you have pasta, adding some extra cheese or oil to make that food more calorically and nutritionally dense. That way you're not having to eat foods that are really airy. The more you can get in your system while you're not feeling hungry, the easier it will be for you not to have to spend a lot of time at that table eating. Avoiding food monotony is also very helpful. If you're able to offer 3 different varieties of food at a meal, even if you're not feeling hungry, likely you'll be able to have a bite or 2 of all 3 of those things instead of maybe a bite or 2 of one item. And social meal support is actually really helpful for individuals experiencing loss of appetite. It keeps you at the table. It has you be engaged in conversation and things other than just staring at that food and thinking, I'm really not hungry right now. Some herbs that have been shown to be helpful with loss of appetite include things like basil, fennel, coriander, ginger, and teas. Bitter teas have been helpful for increasing appetite. These are teas like bitter orange, dandelion, ginger, or tangerine peel. And the way to get the most bang for your buck out of these teas is to drink them about 20 minutes before you're planning on sitting down for a snack or a meal. You can also try supplementing with fish or algae oil, but don't do this if you have any issues with blood clotting. And if you are somebody who is vegetarian or vegan and you don't want to do fish oil, algae oil, or a combination of EPA and DHA oil will help your body make the equivalent oils of those omegas. Next up, we're going to look at nausea and vomiting. We're combining these because most of the symptoms are the same. and they tend to be helpful for both. Small frequent meals again is going to be helpful, not having too much in the stomach at once. Bland smelling and tasting food is helpful. Those strong smells and flavors can just be really overwhelming when somebody is feeling nauseous. One of our main worries when somebody is experiencing vomiting is dehydration. So you're going to see hydrating foods come up a lot. Things like water, soups, things that are going to replete that water and bring that water content back up in the diet. High protein options are also helpful for nausea, specifically the medication-induced nausea. So that would be high protein meals. If you're going to do a meal replacement shake, aim for something that has 10 grams of protein in it. Coconut water is helpful because it has a bunch of the electrolytes to replenish if you're actually experiencing vomiting. We would recommend that over sugary drinks like Gatorade or other sports drinks just because of the sugar content in them. Even if you're feeling nauseous and not able to sit down and have like a whole glass of water, having frequent sips, some people even set timers every 15 or 30 minutes to remind themselves to have a sip of water, because that's a lot easier to do a sip versus a whole glass. Room temperature foods are also helpful. This can also reduce the actual smell of the food in the room if it's room temperature instead of hot, just because the molecules in foods that hot tend to move faster, and that lets the smell travel much quicker. Extremely hot or extremely cold foods can irritate some people and increase the nausea and vomiting. That might be different for you and your child. And teas like ginger, peppermint, and fennel can be very helpful. Next up is dysgeusia or altered taste. There are multiple different types of this that somebody can experience. Some people notice things start to smell different as well because the taste and smell is very connected. One of the ways you could notice it is things start to taste or smell metallic. The way we would combat this is avoiding using anything metal in the cooking process or eating process. So this includes avoid using metal silverware, metal utensils, metal bottles if you're somebody who uses reusable bottles, and even try and cook in things that aren't metal. Pick fresh or frozen options over canned ones just to minimize the amount of time that food is in contact with the metal. And you can marinate proteins in sauces prior to cooking. Like we talked about earlier, our protein sources tend to be very high in iron. Sometimes people end up feeling like they can taste that metallic flavor in foods, and marinating an additional flavor of a sauce on that meat can help kind of hide it. In between meals, if you're still feeling like I haven't had anything to drink, I haven't had anything to eat, I'm drinking water, I'm still tasting metallic flavors in my mouth, chewing sugar-free gum or sucking on sugar-free hard candies that are mint, lemon, or orange flavored are particularly helpful. Try and avoid spicy foods or things with a lot of preservatives and extremely sweet foods, as these can also trigger that flavor. And when you're cooking dishes or meals, utilizing flavors like citrus, pickles, or even just going right to the source of pickles vinegar can help hide that flavor. We also sometimes see people feel like food just tastes bad, almost rotten, or it has no taste at all. And what we can do in these situations is start layering additional flavors on top, things like lemon and citrus, again, vinegar, pickled foods, and sauces, herbs, spices, adding sweet or tart flavors as well. If foods start to taste bitter, add some sweetener to it. If foods taste really sweet, add lemon and salt, lemon juice and salt. Sometimes foods just smell bad overall and the taste isn't impacted. If we're looking at somebody who's really having a lot of issues with these smells, we would recommend eating room temperature foods or foods that are cold. Again, the warm foods tend to just have that smell travel a lot faster. You can use cups that have a lid and a straw to help trap that scent in the cup, so you're able to get that food into your mouth without having much or any smell. Same kind of idea with keeping foods covered, if you can, with a lid and a tray before you're eating, and then only open it when you're sitting down to eat. Ideally opening that lid away from you so that as the air comes out, it's moving away from you and not towards you. Cook outside if you can. Grilling outside or even eating in a room that's separate from the room that you're cooking in, ideally with a door in between to kind of keep the smells in one area and have the room that you're eating in be less warm, both from cooking and from having those smells in there. Rooms that are warm and stuffy are also going to be additionally troublesome for people with that sensation of the food smelling very bad. When we're having somebody who's having difficulty chewing or swallowing, this can be related to dry mouth. Having frequent sips of water, picking foods that are going to encourage your mouth to produce that saliva is also helpful. So those would be like acidic foods or tart and bitter foods, think lemons. Foods that are easy to chew when you're experiencing dry mouth are very helpful because we don't want those sharp edges when your mouth isn't very moisturized. You can easily get cut, and that's not enjoyable. Take sips of water or lemon water every few bites of a meal to help moisturize and rehydrate the mouth. And make sure you're practicing your oral hygiene after meals. When we have somebody who's not producing as much saliva as you normally do, your teeth are at more risk for getting cavities or caries. And that's in part because your saliva actually helps keep the mouth moisturized and fight off that that bad bacteria. Some teas that can be helpful are green tea, like Jess was talking about earlier. We're not necessarily saying drink like 2 gallons of green tea a day, but if you're going to have a cup of tea, 2 or 3 cups of green tea a day is okay. We're talking about drinking it separate from having, again, 2 or 3 gallons, or sometimes people will have green tea supplements, a different conversation. Yarrow, slippery elm, and chamomile can also be helpful with dry mouth. In terms of lubricating the mouth before we eat, some people will do extra virgin olive oil, flaxseed oil, or sesame oil to lubricate the mouth before you start chewing that food. Things like ice pops, frozen foods, sorbet, frozen yogurt, melon slices, pineapple, papaya, or picking fruit nectars over juice will add additional moisture to the mouth. Avoid foods that are going to be high in sugar, things like soda, black tea, coffee, chocolate, alcohol, and any dry or crunchy foods when you're experiencing this. That difficulty chewing and swallowing can also be due to mucositis or sores actually in the mouth. When we're experiencing this, we're still going to opt for those soft and easy to chew foods, things more like pureed, think smoothies, blended soups, milks, soft cooked breakfast cereals, or even scrambled eggs. We're going to try and cook foods in oil to make them more moisturized as we're eating them. And herbal teas with honey can be helpful. Things like German chamomile, holy basil, or myrrh. When you're experiencing mucositis, avoid foods that have extreme temperatures because, again, you're having those sores in your mouth. The skin underneath is very tender and can be easily irritated by those extreme temperatures. Spice is also going to additionally irritate and may even be painful. Avoid things that are acidic, like orange, grapefruit, citrus fruit, tomatoes. And again, we're going to try and avoid those crunchy foods, things like nuts, crackers, even raw veggies when you're experiencing mucositis can be very irritating. Constipation. When we're talking about constipation, one of the things we want to go over is fiber. So we have 2 different kinds of fiber. We have soluble and insoluble. Insoluble fiber does not dissolve with water. Soluble does. It creates almost a gel in your digestive tract. And you can think about it like soluble is going to be you taking a soap and sponge and kind of scrubbing, versus insoluble is more like a broom of pushing things through. So insoluble is a little bit more about motility, and the soluble is a little bit more about scrubbing and forming and keeping that stool soft and comfortable to pass. When you're experiencing constipation, we want to increase fiber in general, but specifically the insoluble fiber to help things move through. Caffeine can be helpful in that motility. Having warm water prior to a scheduled bowel movement, if you're somebody who has regular scheduled bowel movements, some people don't, and that's okay. Having olive oil or honey can help lubricate the gut and help that to pass through. If you're looking to have herbal teas, herbal teas with honey or agave nectar can help promote that intestinal movement. And teas made of senna can be helpful. We want to try and avoid doing supplements for constipation, such as like senna, the supplement, not the tea, or like Miralax if you're chronically constipated. These can lead to a reliance on them and a need to continue using them. It would be beneficial to increase your fiber intake. And when we think about stool softeners, those supplements, they work similarly to the soluble versus the insoluble fiber. We have stool softeners, which physically soften stool, more similar to how the soluble fiber forms a gel and physically helps soften the stool. And we have laxatives, which work a little bit more similarly to the insoluble fiber, which helps promote the motility. We have diarrhea, which is the opposite end of the spectrum. We're going to try and pick hydrating foods here. Similarly to vomiting, we're worried about hydration because you're losing a lot of fluid that would normally be absorbed in the digestive tract. So pick foods like avocado, bananas, apricots, coconut or coconut water, again for the electrolytes, over those Gatorades or these sports drinks because of the sugar content, or clear soups and broths. Avoid things that have high sugar that can additionally irritate the gut and cause additional diarrhea. Try and avoid dairy during the active diarrhea phase. Pick foods that aren't fried. If you want those crisp, crunchy foods, try and pick air fried foods or baked foods instead. When we're having diarrhea, we want to avoid things that form gas. These are typically things like the cruciferous vegetables. Those are cabbages, broccoli, things like that, beans, carbonated beverages. When you're not having diarrhea, these are fine to have, just they can cause additional distress if you're already in that phase. Extremely hot foods or extremely cold foods may aggravate the diarrhea. And just hopping back to the constipation for one moment, when you're experiencing constipation, if you and your medical team decide to add on a stool softener or a laxative, don't in one day increase your intake of fiber containing foods and take a stool softener, because what can happen there is that we end up being additionally constipated. Fiber works kind of similarly to if you're thinking about, so when you picture going down a water slide, you're in like a little tube, you have water and you go down the tube, everything's going well. If we were to put a bunch of sandpaper on the bottom of that tube and turn off the water, you're probably going to get stuck in that water slide, and that's not good. And it's very similar to how things work. If you increase the fiber intake in your diet really suddenly and don't increase the water intake all at once, you kind of stop things up. So we want to not do more than 10 grams an increase in fiber in one day, especially if you're doing it with a laxative or a stool softener, and make sure when you're feeling constipated, even though our primary issue isn't necessarily dehydration from loss of water, we want to make sure we're drinking enough water to promote that motility and that comfort. Some people also end up with an increased appetite or mood disturbances when taking steroids along with treatment. We want to pick, when we're having this happen, foods that are naturally pleasing aromas, things that smell tasty, fresh foods over dried herbs to get that aroma in, and whole grains, things like whole wheat bread, brown rice, quinoa, barley. And whole grains can actually have a calming impact after you eat them, and they promote satiety, which is great. Some people notice that they have anxiety with those mood disturbances with steroids. Some teas for this are going to be chamomile, linden flowers, oat tops, passion flower, and valerian. If you're having this increased appetite or mood disturbances, we're going to want to avoid caffeine or foods with caffeine. So that's coffee, dark chocolate, energy drinks, things like that. They can cause additional anxiety. Foods that are heavily spiced, heavily salted, fatty or deep fried foods, and foods high in refined sugar like cakes, cookies, and foods made with white flour, we want to avoid during this time. People find that when you're having anxiety or just an increased appetite, you're eating almost to self-soothe instead of for a physical desire of hunger. And so this can lead to you overeating, eating things that aren't the healthiest for you, and can lead to weight gain over time. So we want to make sure that we're picking whole grains, fruits and veggies, having our plate ideally be half fruit and veggie, quarter protein, quarter carb, just to help us maintain our hunger cues and still have meals that are satisfying without overeating to calm that anxiety.
So now we're going to talk about some diets for cancer. The big one we get asked about all the time is, should we avoid sugar? I don't want to have any sugar in my diet. This is more cancer in general, not necessarily just brain cancer, but in terms of this, we're going to try to clarify a few things. So sugar is another word for carbohydrates, which is a big umbrella term and includes a ton of different foods. So it includes things you might think of when you hear the word sugar, like desserts, sports drinks, sodas. But carbohydrates or sugars also include breads, pastas, rice, things that you might think of to be a little bit more quote unquote healthy, like quinoa or oats, and fruits and vegetables. And the truth is that all the cells in your body use sugar or carbohydrates as their primary energy source. Molecularly, carbohydrates are the most simple and take the least amount of work for our bodies to break down, so our cells can get the most energy the quickest. So our body prefers to use carbohydrates for energy, and carbohydrates should be around at least about, give or take, 50% of your total daily diet. But the theory around sugar and cancer is that cancer cells burn through sugar a lot more quickly than your other cells do. They are growing and dividing very rapidly, and so they really burn through that sugar. So the theory kind of evolved that, well, if I just don't have sugar, then the cancer cell can't survive and it'll die, and then I'll be good. But unfortunately, the fact is that all of our cells, including very important cells in our heart, our lungs, our kidneys, they all need sugar. And I wish I could just, put something in my body and be like, okay, now only go to my good cells, not my bad cells, but it's not really the way it works. So when you deprive your body of sugar, you do deprive your cancer cells of sugar and they might die, but you're also depriving really vital organs that really need the sugars in order to work at their best. So our goal should really be to avoid or limit excess sugar in your diet. So not all carbohydrates or sugars are created equal. When you look at the picture on the left, those are all carbohydrates, but they also offer a ton of different vitamins, some good proteins, some healthy fats, things your body needs to work at its best, which is what we want when we're trying to fight cancer. Versus on the right, those are all also carbohydrates or sugars, but they don't really offer anything else, and it offers a really high concentration of sugar. So I know we have been asked about like, how much sugar should I have? And that's really hard to say. It's very individualized to the person and how their bodies just digest things. I always say do not avoid all treats. Life is still meant to be lived. So I really don't like when people cut out all sugars. I think it's all about portion control and being cautious and avoiding the excess. So sometimes I'll work with patients on agreeing to one portion of those excess sugars or those less nutrient dense foods. So maybe today I want my small cup of soda. Tomorrow I'm going to have 2 cookies, like something like that. But we want to not avoid all sugars because our body really does thrive and work its best when it's using carbohydrates for energy. Going off of that, however, a more specific diet that we also get asked about a lot is the ketogenic diet. And that is different from saying no sugar. The ketogenic diet does include sugar. So a ketogenic diet is following a very specific ratio of your macronutrients, which are your carbs or your sugars, protein, and fat. It focuses on definitely doing much lower carbohydrates. It makes sure you're still meeting all of your protein needs. And then the remainder or the highest proportion is going to be fat. There's a bunch of different subtypes of the ketogenic diet, and it's really important for it to work properly to have the right distribution of these macronutrients. So if it's something you want to try, you really want to do it with a dietitian who can calculate these proportions for you the right way. The theory behind this is somewhat similar to the avoiding sugar concept. So your brain does prefer to use sugar or glucose for energy. And what happens when you're trying to do a ketogenic diet is you're mimicking what your body does when it goes into starvation mode. When there are no sugars for your body to take in, instead it has this backup plan where it will start pulling from your fat stores and break those down to produce what we call ketone bodies. And the body can use that for energy instead of sugar when it doesn't have that available. But that takes a lot more work and is a lot harder and not the preferred way for your body to obtain energy. That being said, the reason or the theory behind the ketogenic diet for brain cancer specifically is that tumor cells have been found to have a differently shaped mitochondria, which is a component of the cell that uses energy. It's how we break down and use and create energy. So that the mitochondria in the tumor cells doesn't know how to make that switch from fat to, or from sugar to fat like your other cells can. So the theory is that if you create ketone bodies, you'll produce this oxidative stress in the tumor cells and kill those off while your other cells can still switch and use fat instead of sugar and still work. This has particularly been looked at in gliomas, glioblastomas, and DIPG, where the tumors have been seen to really use a lot of energy and have a difficult time with this switchover, as well as the ketogenic diet has been seen to decrease inflammation. The problem is that this hasn't really been extensively translated into action. This is a theory. So when we first looked at mice trials, we saw kind of mixed results. Sometimes we saw decreased tumor growth, improved survival. Sometimes we saw no differences. When we moved on to human trials, the problem with pediatrics is we're always going to start with adults first and then move on to kids. And we have very, very little research on kids with brain cancers trying a ketogenic diet. So because we have such limited data, we haven't seen any significant results yet. So we're not seeing any significant differences in survival rates, tumor growth, neurological functioning. The only thing we're consistently seeing is improved side effects to treatment. And so when you're thinking about starting ketogenic diet, it's definitely something that could be considered for brain cancers. This theory is a great theory. The problem is we haven't really seen a lot of results yet in people. And so you have to think about with your doctor if you think it's worth it for you and your child. The other thing to think about with the ketogenic diet is it tends to have a lot of side effects that are very similar to chemotherapy, weight loss, nausea, abdominal cramping, fatigue, headaches, all of that, which you already are probably going to experience. So it comes with risk. So it's really just up to you whether or not you and your family think risk versus benefit for trying this diet.
The next fad diet we're going to look at is eating only organic foods. When we say organic foods, the definition according to the USDA is food items produced by farmers without using most conventional pesticides, synthetic fertilizers, sewage sludge, or genetically modified organisms, also known as GMOs, while in parallel emphasizing resource cycling. The theory behind this is that some studies suggest a potential link between pesticide exposure and the development of cancer. So those organic foods are being farmed without the use of most of the conventional pesticides. The World Health Organization, or WHO, has classified certain pesticides as probable or possible carcinogens. And the actual research behind this is mixed. Some studies do suggest a potential link between that pesticide exposure and cancer development. Others found no difference in cancer risk based on organic food intake or non-organic food intake. There are also studies that when looking at this difference between the organic and the non-organic food, most of the people who prioritize organic food tend to consume more plant-based foods just at baseline. They tend to limit their intake of processed meats, sugar, alcoholic beverages, and tend to be more physically active. So when we're looking at and reading these studies, it is a question of, is it a pesticide exposure? Is it just that these people are intaking less processed foods? It's all a little muddy right now in terms of what the actual benefit is coming from. But if you are looking to reduce your pesticide exposure, we have ways you can do that. So the first thing is going to be just wash all your produce thoroughly. We typically would recommend everybody wash your produce anyway, wash your fruit and veggies. They're grown outside. We want to get any dirt or bacteria off before we're eating them. But when you wash it, you also take the pesticides that's on the skin off. Consider purchasing from local farms or farmers markets directly. Becoming certified USDA organic is a costly process, and a lot of these smaller farms are already using the procedures that would be considered organic, but are not able to afford the actual label and inspection to come in and get that organic label on their foods. And if you're going to a farm or a farmer's market where you can talk to the farmer directly, you can get an idea of maybe they are using some sort of pesticide, but it is a eco-friendly pesticide, or what are they doing for pest control? Because a lot of farms will have something that they do. It might just not be a typical pesticide. Additionally, we can look at the Dirty Dozen and Clean 15 list. The group called the Environmental Working Group publishes the Dirty Dozen and Clean 15 list yearly, so they will look at what foods have the most and the least amount of pesticides on them year to year. This year, the Clean 15 are pineapple, sweet corn, avocados, onion, sweet pea, asparagus, cabbage, watermelon, cauliflower, bananas, mangoes, carrots, mushroom, and kiwi. The Dirty Dozen are potatoes, blueberries, blackberries, apples, pears, nectarines, cherries, peaches, grapes, kale, collard greens, mustard greens, strawberries, and spinach. You might notice that Dirty Dozen list had more than 12. They combined some of the fruits and veggies together this year. So on their website, it's 12 bullet points, but things like collard greens and mustard greens were paired together. So the way we would use this list is the clean 15, because they're likely to have the least amount of pesticides. If you're trying to avoid pesticides, are okay to buy regular. You don't need to get the organic. They tend to be more expensive. If they already have a reduced amount of pesticides on them, you don't need to be so careful. You'll also notice a lot of the things that tend to come up on the clean 15 year after year tend to be foods that have a thicker peel. So bananas, the cauliflower, pineapple, we're not typically eating the peel of the banana. We're not typically eating the outside of the cabbage. Usually you take that first leaf off. So there is a little bit more protection between that food and the portion that we're eating and the portion that's actually getting the pesticides on them. Versus foods like specifically the berries have a very thin skin, so they're touching a lot of the pesticides on the outside. The dirty dozen list are foods that if you're trying to avoid the pesticides, you might consider buying organic to avoid those pesticides.
And we're not really going to talk much about the neutropenic diet because your hospitals all usually have their own version or guidelines. But what's important to remember is that when you're going through cancer treatment, we decrease what we call that ANC or absolute neutrophil count, which is your primary defense system. So you're at a very high infection risk. And there are some foods that have a higher risk of carrying bacteria, mostly fresh, unwashed fruits and vegetables. So you still want fruits and vegetables, but the fresh and unwashed is not great. Or raw or undercooked meats, fish, unpasteurized products, being careful about community areas. These types of things will then put you at an even higher risk of infection. And if you do get a foodborne infection, the consequences can be much more severe because, again, you don't have a strong defense system. So every hospital is going to be very different about how strict they are about following these guidelines. But most recently, we've become less strict and not saying you can never have a fruit or vegetable, but instead just saying to follow the CDC guidelines for food safety, which is mostly about just preparing food safely, cooking them well, and storing them properly. And we have this link here if you want more details on that. So if we didn't cover everything you wanted to know, or later on down the road you have questions, where do you go? You want to ask for an RD. This stands for a registered dietitian. This is someone who's received a master's degree in a nutrition-related field. They've gone through about, give or take, a 1-year-long training program at an accredited hospital. They're trained in what we call medical nutrition therapy to work in hospital care and acute care and provide things like enteral and parenteral nutrition, which is when we need nutrition other than orally because of GI injury through tubes or into our veins. And they've passed an extensive examination to receive their credential. It's very important to remember that a nutritionist is not a registered dietitian. Some people started using the label RDN, registered dietitian nutritionist, because nutritionist is such a popular term, and that's okay as well. But if someone just calls themselves a nutritionist, that's really not who you want to go to advice for. So any one of you after this talk could be so inspired by our wonderful knowledge and go open up an Instagram account and call yourself Sally Smith Nutritionist Cancer Expert. And there's nothing to regulate that. So you really want to be careful who you're getting advice from and make sure they have the title either RD or RDN. And our last myth buster is that you are not failing if you need help with eating. There's a lot of roadblocks that come up against you when you're going through cancer treatment, and that's exactly why we're here to help. So if you do want help, all hospitals must hire dietitians. They may not have the same amount or the frequent availability, but they're there. And any doctor or nurse at any time, inpatient or outpatient, can put a consult in for you on your behalf to see a dietitian if you'd like. And just don't hesitate and come and ask us for help earlier rather than later. As soon as you're noticing decreased appetite, taste changes, clothes not fitting the same, if you want to ask about supplement drinks as well when intakes are starting to go low, that's what we're here for. And we can be more helpful then rather than us getting called by the doctor when your child lost 25% of their body weight and is weak and falling down. So we love to help early in the process as much as we can. And just remember, sometimes due to radiation and chemotherapy, the GI tract does get injured. And that's when we're also here to help you if your child needs nutrition either through a tube or through their veins, which we call enteral and parenteral nutrition. And it also is a short-term thing that does not mean we are failing. It just means we need help. And that's what we're here for and happy to do. So thank you everyone for listening.
Well, thank you guys. And so now we'll do the Q&A. We'll welcome questions from all of you. So feel free to type any that you have into the Q&A feature. And we already got a few from registration, so I'll start with those. Are there suggestions for transitioning patients off NG tube feeding back to regular food?
Yes, that's something that we are very comfortable with, and there should be dietitians around to help you as well, but it depends on how you were doing the feeds. If you were doing them nocturnally, which means overnight, or as what we call bolus feeds or small meals throughout the day, we usually don't like to start weaning NG feeds until your child is at least starting to consistently eat something at every single meal time. Our usually unofficial rule of thumb is like they're meeting like 20% or so of their calories on their own before we would start to wean. If you're doing bolus feeds, we try to just decrease each feed by a small amount and always offer the feeds after you've offered food first. So the feed should come almost as like the drink you drank after you tried your meal. So they're the most hungry and ready to try foods at meals. If you're doing feeds nocturnally or continuously, we usually say to just start off by cutting out in about like 2-hour chunks of feed, but you always want to make sure as you decrease feeds, they're increasing the amount they're eating. Sometimes you need to hold at a certain sweet spot. A lot of my patients hold at about 50% of their calories from food and 50% from the feeds until we can get strong enough for it all to come on their own. And the last piece to that is checking weights to make sure we're not losing weight as we're doing this, because that would also tell us that maybe we weren't really quite ready. Whether you do that at home, or I usually say weekly at the home or the hospital. You don't want to do it every day because that'll just drive you crazy, but that's kind of how I like to do it, is in a slow stepwise fashion.
Cool. Can you talk a little bit about intermittent fasting with the pediatric population?
Sure, I'll go first and then I'll just let Kath add if they have anything else to add as well. Intermittent fasting has been seen to be really helpful in adults with cancer who are baseline either a what we say a healthy weight or overweight. It can really help with symptom management, specifically nausea and vomiting, but we're really cautious about it in the pediatric population because our primary goal is for them to still be growing like they're supposed to do. And intermittent fasting, taking that away from cancer, it's a diet trend. It's meant to help you lose weight, and that's really not what we want in pediatrics, most especially. So it is something that you can try, but you need to be really cautious of still providing their total calorie needs that they need and monitoring weight trends. I don't know if Kath has anything to add.
Just especially when patients are feeling some of the side effects like nausea or needing to have those small frequent meals, it can really kind of butt heads with the intermittent fasting because in essence, you're doing one larger period of eating. So when you're experiencing a lot of those symptoms, it can be really difficult to implement effectively.
Mm-hmm.
And what about any foods that can be eaten or drank to lower creatinine?
So when you have a high creatinine level, usually indicates that you have some sort of kidney injury or your kidneys aren't working at their best, which tends to happen from a lot of chemotherapies you get, unfortunately. So foods that you need to monitor is making sure you're not having too high of potassium or phosphorus or sodium. All of those put strain on the kidneys, and making sure you're meeting your protein needs, but not exceeding them, because too much, your protein gets processed a lot by the kidneys as well. So you don't want to be overdoing the protein. Protein needs for kids with cancer is varied by age and sex. So again, like talking with a dietitian, if you're able to, they could help guide you with exactly how much protein you should be aiming to consume.
All right, so we're gonna move to the live questions that we've got. Does the risk of multivitamins apply to someone who has taken methotrexate in the past, like more than 10 years ago?
That's a great question, and it does not. So it's really actually only right around the time you're taking the methotrexate because it's all about how your body clears it. So I've even seen some doctors who let you um, take the multivitamin if you're interested during the periods of chemotherapy where you don't get methotrexate. So it really varies. But if you're done with treatment, a multivitamin is really, I think, is a really great option. Um, to use and just help, get your body back to like its fullest functioning.
My only piggyback on that one is we didn't really get into it for today, but there are two different types of vitamins, water soluble and fat soluble. Kind of like Jess was talking about when we looked at the multivitamins, some of them have 300% of your daily needs of vitamin C or vitamin K. The fat soluble vitamins A, D, E, and K are also stored in fat, meaning it's a lot easier to end up with a toxicity or having too much of those in the diet. Typically, we don't see that through just food intake, but if you're supplementing those A, D, E, and K at a high level, you can end up with a toxicity. Versus like vitamin C is water soluble, so if you have 200 or 300% of it, you're more likely to be able to just excrete it through the urine without causing too many issues.
And any tips or resources for essentially training yourself to eat normal again, after being on like a feeding tube and having your relationship with food being changed after treatment?
Yeah,
If
that's, go ahead, Kathy, go first.
One of the things that we have an option to work with here is a speech or a speech swallowing therapist, and that's been really helpful for a lot of my patients who are having difficulties with the physical mechanical swallowing after being on a tube feed for an extended period of time. Because it is a muscle, it is an instinct, but learning how to reuse that muscle and working with somebody who is able to explain how to practice those muscles and where to put your chin to most benefit where you are at in your journey has been really helpful for some people.
Yeah, that's really great. And then if it's not so much mechanical, um, it can be really, really hard to kind of get back to a quote unquote normal eating pattern. I definitely say give it time. It takes a long time. Cancer treatment is a long time, so recovery is a long time. And it can be a lot on the parent's role to help model proper eating behaviors and work with reestablishing a routine. So because you're dysregulated and your body was used to getting food all night, which isn't natural, and then you're not hungry during the day, it's really helpful to try as best as you can as a family to restart a a relatively stable routine pattern. So like we eat breakfast roundabout at this time, lunch, dinner, and then maybe like 2 snacks throughout the day, but you stick to those meal times, knowing, hey, I might feel hungry right now, but I know my body doesn't need the food because I just did have it an hour ago. So the nutrients are enough to hold me over. So that's one way that's really helpful to work with that dysregulation and relearning your hunger and satiety cues. Carrying water with you at all times, because a lot of times all of us confuse hunger and thirst. So making sure you're staying hydrated is important in that process. Um, and making sure you're eating balanced meals. So every time you eat a meal or a snack, making sure it has a carbohydrate and a protein, because carbohydrates, we absorb them really quickly, but then that means we kind of burn through them quickly and could get hungry again more quickly, versus when you pair that with a protein, it takes our body longer to break that down. So making sure you're having a fully balanced meal and snack every time you eat to reestablish that like proper eating pattern.
And this will be the last question. I know we're a little bit over. And it kind of piggybacks off of that one. Tips or resources for someone struggling to lose weight post-treatment.
Yeah. Um, I would say I definitely want to hear what Kath has to say as well, but I would say we all forget a lot about the importance of physical activity. And I know you tend to be weaker after treatment's over as well, just from everything you went through. But starting small with things like daily 20-minute walks as a family after dinner, or another activity that they or sport that they like to do, even if you start with shorter periods of time. But the importance of physical activity paired with diet is so important. And being physically active in survivorship has also been shown in studies to decrease rates of relapse as well, or they're associated with it. So physical activity is a really big one, even if it's not like what we're picturing, like some buff guy hitting the gym or something. It can be really small things like walks, swimming, things like that is really important. And then again, same thing, focusing on the balanced meals. So sometimes people think less will be helpful in losing weight, but really making sure all your meals are routine and have nutrient dense things included will help your body reestablish like that eating pattern, and giving your body time to digest foods before you're putting more foods back in, and like relearning that whole process. Because the other piece of that is that your stomach really is it's a muscle. So just like, so I give my patients this example all the time, but just like someone who broke their arm, who used to go to the gym and now they're back, you usually have to start off with lifting lower weights and slowly building yourself back up. It's kind of similar, where you have to like retrain your stomach how to properly digest things and give it time to learn how to become satiated and then get hungry again, and go back up and down like it used to. So it just takes a lot of time.
Depending on the age as well, being able to revisit foods that maybe you didn't like during treatment, because there is a lot of taste and preference changes that happen. Having those balanced meals, having a fruit and veggie, ideally at every meal, can help, because a lot of people end up really craving those carbohydrates, and those digest really quickly and leave you really hungry very soon afterwards as well. Also, just being consistent with what you're doing. I find some patients will try and decrease the amount that they're eating, and what happens is they're not eating enough throughout the day and they end up ravenous by nighttime. And when you're at that point of already being ravenous, you're not necessarily thinking, oh, I should have a vegetable and a whole grain and a protein. That way I feel satisfied for longer. Your body is screaming at you that I'm so hungry, I need you to feed me now. And so you're going to have a lot of food in one sitting and likely overeat to the point of being extremely full and uncomfortable. When this happens over and over again, it can really change how much our stomach is able to take in. And over time, if you do that 3 days in a row, you're probably picking choices that are not as nutrient or vitamin and mineral dense, and it can make it harder for you in your journey to change your weight.
Cool. So I think we'll end the Q&A there. And I want to thank both of you so much for taking the time out of your day to do this webinar for us. And I know it takes a lot of time to put all this stuff together and all this information. It was awesome hearing from both of you. And I also want to thank our attendees for your participation and thoughtful questions. The PBTF is here to help no matter where you are in your journey. So please reach out to us for support. And we'll be sending you a link to the recording of the webinar as well as the slides from today's presentation. So yeah, and also we'd love to hear your feedback about how we did. So if you want to scan that QR code, you can scan it now, or it'll be in the slides when we send it. So yeah, Kathryn, Jessica, thank you guys both so much. I really appreciate it. And I hope everybody has a good rest of their day.
Thank you
Thanks
so
so much
much
for having us.
Yeah.